Around 600 lives are being lost needlessly every year across Wales because doctors and other medical professionals are not following basic procedures. That's the warning of a committee of AMs investigating hospital-acquired blood clots or thromboses.
The total number of deaths is substantially higher than the number of people being killed by breast cancer, AIDS and MRSA put together. AMs say 70% of the fatalities could be avoided with the right approach.
Our health correspondent Mary-Claire Carey-Jones has been finding out about the devastating effects of thrombosis and what can be done to prevent it.
Daisy Pritchard from Wrexham was just 2 years old when she developed thrombosis, but she will live with the effects for the rest of her life. Daisy was in hospital recovering from a heart operation when a blood clot formed, leaving her with brain damage.
Obviously she has limited use on her right side from the effects of the blood clot. But you don't see the damage, and as she grows older and as she gets older, like she's 6 on Friday, each month we find something different.
But figures from a damning report show Daisy's case isn't unusual. In 2010, around 900 people in Wales died from hospital-acquired blood clots, but 70% of those could have been avoided. Major surgery, infection and lack of movement can all cause a blood clot to develop, but measures can be taken to prevent the risks.
Ready for the stockings to go on?
On this ward at the Royal Gwent Hospital in Newport, they use compression socks, and patients like Muriel Hanford say that gives them peace of mind.
They protect your legs, from thrombosis and all the rest of it, and they're nice and warm as well.
But a doctor from the thrombosis charity Lifeblood told me there are no regulations for using socks and thrombosis medication.
What we're seeing is inconsistent practice. So you may go to one ward where it's being done brilliantly and every patient is being assessed and receiving prophylaxis, and another ward where it's not happening.
That's why patients need to be aware of the symptoms. They include pain, swelling and tenderness in the leg. There can also be a heavy ache, and the skin is often warm. Patients should also look out for redness of the skin. But the National Assembly's Health and Social Committee believes the health service should do more to identify the risks of blood clots before they happen.
We ought to do that with every single patient who is admitted to hospital as part of the routine checks that are done when people arrive. But having assessed the risk, you've got to go on to take a second step, which is to make a conscious decision about the treatment that is needed.
The Welsh Government says those recommendations will be considered carefully, a move that will be welcomed by Daisy's family. Mary-Claire Carey-Jones, Wales Tonight.
Well, you can read a lot more about this report and links to advice on how to safeguard yourself and your loved ones on our website. The address is itv.com/Wales. That's itv.com/Wales, with libraries and GPs also offering advice, of course, if you don't have access to a computer or smartphone.